All right, good morning, everyone. We are going to go ahead and get this webinar started. Please let me know in the comments section if you are having any problems hearing me. We are doing things different today, so I hope you all will bear with me as we figure it all out. All right, let's get started. So, for today's agenda, do some welcome and introductions, general updates. We're going to talk about everything PE 46 before we jump into everything data. We'll have a panel discussion and more like a handful of people presenting on a panel. And then we're going to do something we haven't ever done on PE 46 webinars yet, which is open up the phone lines and let you all talk. So I'm really excited to try that out. I got a bunch of phone codes, unmute and mute. So bear with me today as we figure out the sound. I have someone here and one of my awesome colleagues, Rachel, who is actually monitoring our questions. So feel free to, if you have questions, you can type them in and Rachel will monitor them for us. Okay. Oh. All right. So you know how I love polls, y'all. So let's practice our polls. This webinar is no different from all of the other webinars that I do, and we will be using Poll Everywhere. So if you would like to participate live with us, all you have to do is text PE46 to 22333. Or if you're participating via the web, you can use the following web link below there. This is what it would look like from your phone/computer. Another view of that. And let's practice using one word. Tell us which county you represent. This is a word cloud option. Lynn in the house, Columbia, Jackson. Give folks a few seconds there to participate. Again, you can respond via Poll Everywhere by texting PE46 to 22333. Clackamas, we see you. All right. So let's practice some Grant County. I see you. Harney, Jolene, I know that's you. Polk. Probably Jackie. Jackie, now you can see my face that you've heard my voice. I got to meet Jackie in person last week, and the first thing she said was, "I've heard your voice." Yeah. And so it's really great to meet her in person. Okay, should we practice another poll? Yeah. Okay. So, you know, because of the time of year we're in, and please let me know if you're having any problems with these polls. I like cold weather. Yes or no? Half and half. Some like it, some do not like it. I like cold weather. It looks like, for the most part, people are not into cold weather. I'm not going to lie, I also do not like the cold weather, but it is what it is, isn't it? Okay, so you're getting the hang of these polls. So this was a yes or no poll. Let's practice yet another poll. Okay. I am taking off time during the holiday season? A, I can't wait. B, break? What's a break? And C, the holidays are coming? Okay.
Nice. That was fun.
Yes, we've got a little bit all over the place. Yes. And the holidays are coming. That person, yes, I'm with you. But also, at noon, I am out, and I'll be back after the New Year. So I also can't wait. Okay. Next poll. The thing I am most excited to eat this time of year. This is a word cloud. The thing I'm most excited to eat this time of year is wine. Okay. Classy. I love it.
Brandy.
Fudge. Ooh, my mama gave me some fudge. Potatoes, cider. Pie. Oh my gosh, look how giant pie is. Noodles, chicken noodles, pretzels. Oh, Cadbury's. Homemade.
I think chocolate.
Yo,
Chocolate.
fancy.
Chocolate and pie.
Cadbury. Ooh. Baruch. You all, I want to come eat with you. This looks delicious. Cranberries. Okay. Thanks for playing my fun polls, everyone. Just getting us into the spirit of what is to come next, which is some fun updates. So I just want to give you a handful of quick updates. I'm going to talk about triennial review in the next couple of slides, as well as our webinar schedule and webinar topics for the next year. So let's get right into it. I know you don't like cold, so here's a picture of something warm looking.
Oh, thank you.
So, okay, triennial review. I first want to say that you all can have access to these slides. I'm going to have this webinar is being recorded, and I'll save all the slides and add them to the PE46 website. But this is a little bit of what I'm going to be looking for in triennial review. And I'm bringing this up because a few of you have started contacting me around the triennial review process. I will start triennial reviews in January with Washington County. So to give you a kind of a taste of some of what I'll be looking for, this is some of what I'm going to look for. So evidence of your community partnerships, events, flyers, other materials, any formalized MOUs that you might have, any documentation that you might have that demonstrates that your plan has been implemented or that you're working on that. So if you're having meetings, those sign-in sheets, agendas, lists of who attended those meetings, documentation that demonstrates your activities have been evaluated. So if you're working on an assessment, looking at what you're doing related to that assessment process, survey results, evaluation from advisory groups, focus groups, any documentation that demonstrates modifications made in response to your evaluation. So if you do an evaluation and they say your clinic hours are horrible and you change your clinic hours, then I'm going to consider that a response to the evaluation that you've done. And then any documentation that demonstrates that you're either providing clinical RH services as an RH certified provider or you're actively engaged in connecting with other providers. This was really basic. This last one is the nuts and bolts of your PE46 plan. You all should know whether or not you checked that first box, I'm going to provide clinical services, or I am not going to provide clinical services. So as far as I'm concerned, you all are like passing this one with flying colors because you wouldn't have made it this far in the process had you not done that. So again, these will be saved to the website. You can use them. More importantly, this is just me guessing. We're starting PE46 brand new. You might think of new things that I didn't list here that you want to show me as part of your review process, and that is 100% okay. I'm totally open to it. If you have any questions, feel free to reach out to me. I have already reached out to a few counties that are up for review in the next 3 months. But if I haven't been in contact with you, I will be reaching out after the first of the year to schedule your review.
We have a question.
Oh, questions. Okay, what are my questions?
Okay, this is from Charlene. Multnomah County had their triennial review for Title X last year. Is the PE 46 review timeline different, or will this align with our next scheduled Title X review?
Great question, Charlene. This will align with your next scheduled review. So if you had a triennial review in 2018, you will not have your next triennial review for 3 years. However, the nurses are still doing clinical reviews, and they have their own clinical review schedule, which I believe aligns with the triennial review schedule. So hopefully that answers your question. I'm looking at Washington, Tillamook. I know Deschutes is in May. I can't remember who's in between. So there's a few coming up this year. And I know the most important thing that I want you all to know is this is new, and we know that. So don't freak out about what you need to turn in. We're going to work together. I just want to see that you're making friends. PE 46 is all about making friends, okay? So I want to know who your friends are in the review process. Do we have any other questions?
Nope, that's it.
Okay. So moving ahead, I'm being conscious of time because we have so much awesome information to share during today's meeting. Okay, so here's a sneak peek at the webinar schedule for 2019. As you can see, I have a lot of to be determined, but I have a list of what you want your topics to be. So of course, we're starting with data now, but I just want to let you know that I anticipate we'll do data again because we are just skimming the iceberg as far as data information. Here are all the other topics that you all wanted. I'm actively working on solidifying that. In January, we have someone coming from the state transportation program who will be able to answer any and all questions around transportation. I especially encourage you folks in rural communities to be on this webinar because I want us to be able to get any transportation questions answered no matter where we are in the state. Okay. Any questions?
Yes, we do have one last question. This is again from Charlene. Is there just one review focusing on the points that you mentioned, Dolly, or will the review also include the clinical information that we provided during the Title X review?
That's a great question. They are two separate reviews. Your old triennial review that used to also include the clinical review is now PE 46. So moving forward, PE 46 counts as your triennial review. If you are a clinical service provider, you still have to do clinical reviews in addition to the triennial review. And the nurses, Carol and Linda, will continue to reach out to you when it's time to schedule your review process. Did we have any other questions?
I'm not seeing any other questions.
Okay.
But keep them coming.
Keep them coming. We are going to unmute you soon enough also and let you talk on the phone. Okay. So moving right along, everything data, part one, as I said, because I think we're going to move into this a lot more. So you know how I like talking about modernization. So things I wanted to tell you about modernization today is that, yes, we're, through the work of PE 46, we're still talking about equitable access, we're talking about community partnerships, and also health equity. But when we talk about data, we're bringing in a new element to modernization, which is quality improvement. And this is actually falls under leadership and organizational competencies. So I tell you all of this to say, you know how I feel about modernization. I feel like the more we know and the more we can connect to this, the more opportunities in the form of funding perhaps could happen for us. So when someone asks you how this work connects to modernization, here's your answer. So let's do another poll. What stage are you in your data collection? What stage are you? A, don't know where to start. B, I know what type of data to use, but haven't started compiling it. C, I have compiled baseline data. D, I have an evaluation plan for using data. Or E, we're already evaluating progress. So I'll give you a few seconds there to respond. So we've got a few people who are saying, I don't know where to start. Some that say, I know what type of data to use, but haven't started compiling it. I've compiled some baseline data, and I have an evaluation plan for using the data. So we're kind of all over the place, and that's A-OK. That's literally why we're here today having this webinar. We recognize that we're all in different places, and that is 100% okay. All right. So what data are you starting with? I don't know. So let's think about that. So one way that we can kind of start thinking about this is to do some process mapping. And I have invited my buddy Stephanie to come and talk to us a little bit about some process mapping that she did here for the Public Health Division. So, Stephanie Krupp, did I say your last name right?
You did.
Please take it away. Tell us about process mapping, and feel free to use the mouse.
Sure. So for the Public Health Division, and I run process mapping sessions to help different teams brainstorm what it is they need to do for any kind of improvement or any kind of organization of ideas. And this was a recent example. It does not directly relate to PE 46, but I had a group of 4 people come together that were involved in a project together, and they worked in different departments, so they needed to connect. And we just brainstormed the work that they did and put it onto the wall using sticky notes. So one of the reasons Dolly invited me to talk was because she realized that all of you probably have sticky notes and that you probably have markers. And so that can get you started just brainstorming what you have. And that's part of the beginning of a needs assessment, potentially, or mapping a process if you're looking at something to do with your clinic or a partnership. It helps define roles. And so we can click forward in this process. So for this particular process that we were looking at, there were multiple people involved that need to be involved in different steps of it or different parts of a work plan. And so we took little dots. You may or may not have these, but you can get multicolored dots, and each role is assigned a particular color. And then through that process, you can stick those on your sticky notes, and you start to create some organization of ideas you have in your head. It starts to become a little bit more visual and concrete. And so if we click onto the next one, we added the green stickies indicate when things need to happen. So that helps you start putting in some deadlines. And so for this particular process, there's a lot of people involved. There's a lot of forms. I don't know if you can see those big yellow stickies involve submitting things. And those green things tell us when they need to be submitted. And then the roles are clearly defined. And we took that and turned it into just a quick overview on a PowerPoint slide. And this kind of just helped transform what was on the wall into electronic form. And then when the group looked at this, we realized this wouldn't be helpful for them to really think about their work plan and who was involved. So we took this electronic version.
Oops, hold on.
And Dolly's going to we turned this into a Word document. If I'm talking too fast, just let me know. Okay, so we created a roles, kind of a responsibility matrix. And we clearly defined, again, this is not a PE 46 topic, but who are all the stakeholders and partners involved? And that's one of the most important parts about this brainstorming process. And one of the great things about the work that I do is that we can really think about who does this work impact? And just as we start to document, we put that list, you'll see it in a little bit, on a whiteboard. And as we're doing the process, we're always keeping our partners in mind. And as we're fleshing out steps in the process or steps around work, always identifying who else is this impacting, who else needs to be pulled in. And this really helps early on in the process to make sure you start looping in the right people and pretty much the right people at the right time. and it helps you understand what resources you have. And so we took all of that stuff on a wall that we turned into a PowerPoint slide and realized that wasn't going to be helpful. And we started to flesh out, what's the step that needs to be taken? What timing does it have? And who's responsible for completing that step? Now, you can also do this around data. When you start to brainstorm, what data do we have? Who may have that data? How do we connect with them? What timing do we need? You can start doing this same type of work and creating a plan for yourself if you feel like you're kind of stuck on where to go. This is kind of a fun way to get it up and running.
Can you explain the RACI a little bit?
Sure. So RACI matrix, RACI is a way to, and you'll see this is a modified RACI. If you Google RACI chart, it's RACI chart. It helps you identify when you're dealing with a process or kind of a roles and responsibilities. We actually use it in our office with we have an operations team, and everybody has different pieces, like to answer phones or check on the door or get the mail, like just basic things. Who's responsible, who's the backup. And so in this particular instance, we didn't use accountable and responsible and consulted. There's no backup per se here, but for this particular process, somebody needs to do the work and somebody needs to approve it. And that was really important for this process. So you can use this RACI concept to meet your needs. If you have a bunch of people involved and you want to show, and this is really helpful when you're working with partners around the consulted and informed. Sometimes you need input from a group, and sometimes you just need to let them know what's happening. And so that can be really valuable when you're building relationships. Thanks. Thanks for the question, Rachel.
Do we have any other questions thus far? We're going to get to mad question time, so don't worry, folks.
I'm not seeing any questions at this time.
Okay, so let's talk then about, and Stephanie started to talk about it, subject matter experts. So it's really helpful to do some interviewing of people that might be in your community that might have some information that could help you, right? I mean, it's pretty easy in that sense. So one very simple question that you might ask these folks is, who else should I be talking to? And one thing I wanted to point out, and I think I can click on this and it'll go directly there, is that Multnomah County has a really great equity tool that asks some of these questions. So this is actually...
This is City of Portland.
I'm sorry.
It's equally good.
Ooh.
I say, I don't
was gonna
recognize that
say.
one.
So sorry, that's like a bad faux pas, I'm sure. City of Portland has a really great racial equity toolkit.
Multnomah County does
We
as
do.
well. Yeah.
Yeah, Multnomah County does as well. But this is online, it's on our slides. This could be a great way for you to think about how to do this work. So just wanted to share that, think about who in your community, like if you're trying to work with youth, who in your community is really connected with the youth?
And I have one thing to add, this is Stephanie, just with any of the racial equity tools or equity tools in general, they're really helpful when you involving, like thinking through that brainstorming process of who are the partners and who should really be reached out to. And that's one of the reasons why there's multiple ones we can share as resources that just kind of help you think through that process.
Thanks, Stephanie. See, this is why I have a panel of experts. They know more than me. So we talked about sticky note process mapping, but here's a good old-fashioned whiteboard. And I just wanted to show you this one. This is, again, Stephanie's work, but they did this one specific to stakeholders. So I think it's really important that it's okay, what I like to call brain jam, and just think about who you know, what you know, and get it on paper. The other thing that I wanted to just point out to you is that it's really important that you document it. And I say this because all of this could be helping you come triennial review time. And so most of what I took from Stephanie literally were things that she had slapped into a PowerPoint, which I thought was brilliant. So she took pictures of all of these like process mapping things And to just organize her work, she had it stored in a PowerPoint presentation, which was, I thought, brilliant. So I wanted to share that one idea with you. Take pictures, save your meeting notes, like create a file folder and just start putting stuff in there. Document what you're doing, because what you're doing matters and it counts towards the review process. So I just wanted to, again, encourage you to document all the things. Okay, so one thing that I am doing this research and thinking about who should I include, I met Tim at a training and was like, you're a cool dude and you know a lot of stuff and I'm going to find a way to get you involved. And then he started telling me about Ronnie and the work that they were doing together with the Healthy Birth Initiative. And this idea of cultural humility while collecting data came up. And it made me just think that we need to be thoughtful as we work with community and potentially with new communities that we haven't engaged with before. And so I'm going to hand it over to Tim and Ronnie to just tell us a little bit about the work that you've done together and what our LPHA's, local public health authorities across the state, might benefit from.
Sure. Are we live here?
You're live. That's your microphone.
Live. Hi, everyone. We thought we'd take this as a really formal conversation, mostly because we're new to presenting this. I think we've been doing this work for a while. So I don't have any cool slides. We're just going to talk and let you take notes. So yeah, my name's Tim Holbert. I self-identify as white male because y'all can't see me or hear me, or you can hear me, but you can't see me, which is important in this story for me. I've been working on health equity issues as a researcher and evaluator for about 10 years. I actually helped evaluate and design Multnomah County's equity and empowerment tool, and love to talk about tools, their strengths and their weaknesses, because most of them have both of those. Yeah, that's my little intro. I work primarily these days as the evaluator, researcher, data person, quality improvement person for Healthy Birth Initiatives, which is Multnomah County's. It's one of about 100 Healthy Start grantees nationally. There's 2 in Oregon. One is Healthy Birth Initiatives here in Multnomah County, and it serves all African-American women who are pregnant or parenting at risk for delivering preterm. And Ronnie, you want to?
Sure. And I am Ronnie Myers. I'm a program specialist senior with Healthy Birth Initiatives. I identify as a white female, older white female. And I worked with Tim on the development of the Multnomah County Health Equity Tool in that process a long time ago, right? Right.
Yeah, we just sound like old people. Back in the old days. Yeah.
Right. So I've been at the health department for 28 years, actually, and worked at the Red Cross before that on HIV prevention and other community outreach programs. So I have been working and supporting communities that I am not a part of necessarily for over 30 years. And my job at HBI, Health Birth Initiative, is to support the Community Action Network and community engagement process. And I also support the consumer leadership group that we have there. Yeah.
Great. And we don't have like a framework for cultural humility. I mean, we're not coming here. I want to disabuse anyone the notion that we're experts. Thank you, Dolly. It's very sweet of you. But we both have experience, and I've been working with the African American community for about 10 years, but also some work with the Native American community locally. Yeah, so just kind of disabuse you of that notion that we're experts, but which actually goes to the heart of, I think, what cultural humility for me means, especially with respect to being a researcher and a data person, and that's a learning stance, like really going into experiences, knowing that I do have some knowledge and I do have power, and trying to share those as much as possible, but to really take a learning stance, to learn from communities, their own stories, their own expertise, and what it is that they need from me. What data do they want to see? How do they want to see it? How do they want to interact with it? And in the sharing of the data, and in any kind of data collection or any kind of advisory work, like really how do they want to be connected with? How do they want to be involved? So that's kind of the heart of the cultural humility piece, Dolly, for me. And then we thought we'd some other basic principles that we use. I think a key one is really being transparent with communities, really being honest about, one, what is the goal, two, your limitations, and three, what you're really asking of communities. Are you asking them to simply advise, it's like a one-time, one-off advisement on something that you're looking at, or are you looking for more kind of a long-term experience? I think I try to encourage building relationship with communities and for the long term, and kind of pushing the comfort edge. We're kind of used to like, oh, let's do a focus group, let's do a little advisory group, but really let's kind of advance the edge of empowerment and involving communities as much as we can at every step of the as possible, recognizing that we have limitations and we have certain guidelines, but being really clear with communities about going into a process about like, well, here are the things that we have to do. Here are our requirements. Here are, when working with HPI, it's clear of like, it's like, here are our grant requirements. We are required to report on these things. Given that, where's the room for dialogue? Where's the room for exchange and input? So I'm always trying to encourage us to go a little further, but being very clear and very transparent with communities and people about what those limitations are, what you can, and what role you're asking them to play.
And I guess I'd also say to that community knows what's going to work within their own community, and so we do have certain requirements on what we need to do, but the data, it's the community's data, and they do have a lot of knowledge, and they don't always know all the epi terms and all that kind of stuff, so that's an issue of training. But the community knows what's going to work and what's not going to work and what's happening in the community. So if you have epi data showing certain things, we might have our own assumptions about, for example, what's happening, why things are happening, but it's not till we go out to community, talk to community about it, that they really know, why is this happening? What are they hearing? Who's saying what? What's going on? So really that involving community from the very, very start.
Absolutely.
And taking, working with that knowledge.
Yeah, I think a good example I have of that is like one of the requirements for our grant is we report on safe sleep behaviors. Most of you are familiar with those. And that's one of the benchmarks for our program. So what I do is I try and bring that data on our benchmarks to staff. All the staff at HPI are from the community, so they play a dual role. And ask them like, so what's happening, what's going on, and they're able to really provide the story for like the rich story of like what's really happening. That the benchmark, it just says whether we're meeting it or not. It's not saying like, well, what's really happening underneath that. So, but I really appreciate your point about really understanding that the data, for the communities that we work with, the data is personal. It's not objective. This data is about their lives. Which brings up one of the things when Ron and I were talking about, one of the key things I think to understand, I think going into this work is that, it doesn't have to be perfect. We do have to advance the edge and to be transparent with communities about that, but also realize that that trauma can be a serious issue for people, and that presenting data or asking them to go through experiences can be, it can be re-traumatizing, but it can also be a healing experience too. We've had examples about that both. You want to talk a little bit about that?
I was talking to Tim a little bit about when we were doing some reproductive health work. And so we had brought consumers together to look at what we had been working on and give input for it. And so our opening question, and we had folks from the community, our consumers and other folks from the community in the planning group who had put together the outline. So our first opening question is kind of the warm-up was, when was the first time somebody talked to you about sexual health? And so everybody went around, but we realized afterwards that there were several people in the room who had been sexually abused as yet really young kids. And so it had brought up a lot of trauma for folks. And so it was a really great learning experience for all of us to really, really think about when we're going to ask questions around where is the potential for trauma around that, and to really keep that thought process really open and thoughtful about it. And then how do we talk it through later on? So we were able to talk it through later on in the session, but really keep that trauma in mind.
Yeah, I don't want that to keep anyone from doing the work, but it's just to keep that in mind and to give yourself 10 times more the time that you think you need to do this work, because it just takes time, and going slow is going to help with that. A kind of a flip side story to that is that we did a series of focus groups on toxic stress and birth outcomes. And so one of our concerns was that, well, these could be, we're going to asking women to talk about these really intense experiences. This could be traumatizing. And in fact, it was a healing experience for them. Most of them said because they were able to come together as a group, to see other Black women in the room talk about their experiences in hospitals, their experience with providers. And for them, that was actually a healing experience. So I guess part of this is just to encourage, I think, that while we talk about data and we think about it, it's objective, that there are these very emotional, very personal aspects to data as well. And I'm mindful of our time.
Oh, thank you.
There's tons more we could talk about. So happy to.
And what we're going to do is we have another example, and then we're going to open up the phone lines. Do we have questions? No questions?
I'm not seeing any questions right now.
And again, I'm going to open up the phone lines. Next, though, we are going to have Rachel Burden from Clackamas County. And Rachel, I'm going to figure out how to unmute you. Okay. Okay. Rachel?
I am seeing, look at this, it says attendee cannot be unmuted until they enter their PIN. Click to send their PIN. Should I just click?
Yeah.
Okay, audio PIN has been sent to Rachel.
Okay. Hopefully Rachel is going to be able to talk here. Thank you, everyone, for giving us one moment.
We could, there's one more thing we could talk about at one time if you want to do it.
Yeah.
Okay. Brian was pointing out one of the key things that we wanted to talk about was communication with community partners, and really the importance of circling back with community members about the results of whatever input or participation they've given and how important that is. Do you have an example of?
Yeah, I mean, this is something I've heard over and over and over again with communities, particularly within the African American community, of people coming in, asking people to give input, give data, making their reports, maybe even writing grants for their own funding around it, but not going back to the community and giving the results and sharing those results. Yeah, so we did just have a recent experience with that. Where somebody worked with our leadership group on coming up with research questions, et cetera, and then just kind of dropped the ball. And we never heard back. We haven't heard back yet. So in the evaluation, the kind of debrief, that was exactly what people were wondering about. So what's up? What's happening? This is what happens all the time. And it does happen a lot. So really, it's so important to bring the info back and see how everybody can work together with that information to make things better. Yeah.
And to do it more than once in multiple formats, I think is as much as possible. Yeah.
Thank you, guys.
Rachel says she's entered the PIN, but she's still not unmuted.
and you can't unmute her.
No. No, it just says attendee cannot be unmuted until they enter their PIN. She has already entered the PIN.
Okay,
So,
Rachel, can you try calling the original call-in info? If you have the original email invite. Let's try that. But Rachel is doing PE46 work in Clackamas County, and part of the reason why I wanted her to jump on was because she and Clackamas County have asked me the most data questions, and I was like, I don't know. And that's part of, I think, what I wanted you all to know, is that just as much as you're figuring this out, so am I. And I feel like that is okay. One of the things that's important, and especially as I think about data, is that data, there's always money connected to it. And so even if you don't know what you're doing, if you can figure it out, you might be able to find some sustainability for your program or for the work that you want to do. That's why I talk about modernization so often. So I'm hopeful that together we will figure this out. The folks that are in the room with me today are also very knowledgeable, and if I don't know, I go to somebody else, which is exactly why I've asked them all to be here with me today. So we are trying to connect with Rachel. I've unmuted all of the phone lines, so everyone should be able to.
she is connected to the audio now.
Yay. Talk, Rachel.
Wait, let me see. Oh, wait. We can, okay. All right. All right, Rachel, I think you're unmuted.
Can you hear me, everyone?
Woo! Collective excitement.
That was a team effort.
Okay, Rachel.
All right. I will buzz right through these, but just want to tell you a little bit about what's going on in Clackamas County around assessment. And as you all know, we have chosen to identify barriers to access and gaps in reproductive health services, and also do a little bit of the program component A, which is engaging some partners around looking at data and understanding the reproductive health picture in Clackamas County better. So you can go to the next slide, Dolly. And this is really just a dumbed down version of what I call our Clackamas County's action plan. And there are 5 components to it. We're looking at quantitative data, of course. We're creating what we're calling a provider inventory. And we will be collecting qualitative data, hearing from the community. Also a policy scan of the reproductive health landscape, and then we're going to take that all and understand it, interpret it better. And a key piece in doing the interpretation is we're going to engage some partners around that. So we've already started looking at quantitative data. We've started the reproductive health inventory, so the orange and yellow are really underway. Those 2 pieces will inform what additional data we need to collect and what we need to hear from the community to better understand. And I'm sure many of you know, just given the federal and state policy landscape, understanding what policy levers might be important for us to at least be aware of or potentially have some action around. That'll be part of our policy scan. So the next slide, again, just a visual to show really why are we doing this assessment and what the results or the outcomes we hope will be of this. So this year's work is really doing the assessment, and we want to better understand what the issues are in our community and what the capacity is to respond to those. We're going to use this work of the assessment this year to inform some work in next year's plan for reproductive health. So we'll create a strategic plan and really start to engage community partners is the third result that we hope to see. And I'll say a little bit more about that before I'm done. And then when it comes to data, as part of our initial planning in this assessment, we did some brainstorming, kind of not too much unlike the process mapping that was mentioned earlier. And there's a lot of data sources out there, quantitative, and then potential sources for who we might talk to in the future to create a better picture. And what we have narrowed in on initially is looking at vital stats data, because in Clackamas County, we have geographically divided up the county into what we call health equity zones. And we're really interested in Clackamas County and looking at a sub-county level, because Clackamas County is such a diverse county, both geographically and then the people who live within each health equity zone. And vital stats is really the only data set that we were able to look at that sub-county level. Now, that's not to say that all of the other potential data sources won't help us paint that picture and understand reproductive health better, but vital stats is where we started, and we're looking specifically at unintended pregnancies, and kind of within that, a bunch of different parameters that we can see around unintended pregnancies, as well as induced abortions. That's another field within vital stats we can see. And again, within that induced abortions, we can also see a variety of different parameters around that. So just saying vital stats is where we're starting. The qualitative data collection piece will happen a little bit later in the year, but again, who we talk to in the community is going to be informed by what we see in the quantitative data. And the next slide, what I wanted to share around that. Oh, right. Here's a map of Clackamas County, and just displaying kind of our health equity zones. And the health equity zones, it's really a tool and a framework that Clackamas County uses, not just for reproductive health assessment work, obviously, but really to better understand the communities within Clackamas County, but also to look at data in that way. So I'll just, Dolly, move to the next slide. Thank you. This last slide, what I wanted to share here is really to say we in Clackamas County are using modernization to organize the public health division. And so reproductive health work sits within what we call our Access to Care program. And along with that is the maternal child health work, immunization work. And so this assessment work is happening within the broader context of access to care, more broadly than just reproductive health services. And at the same time, we have a communicable disease program. And earlier this year, the communicable disease program released what is called a health, sexually transmitted disease impacts report. So we have programs within the public health division that are organized by those core programs that you all know from modernization. And then kind of what supporting all of the programmatic work is our Center for Public Health Advancement. And those are really helping Clackamas County address the core capabilities within modernization. And so what we're doing is, because we have an impact paper that's been released through support from the Center for Public Health Advancement, but really as part of that infectious disease and communicable disease programmatic work, we are engaging a set of community stakeholders, both to look at data from the STI impact report, but also as part of our reproductive health assessment, engaging communities around looking at that data together. And so we're having a stakeholder group, or what we're calling a coalition, come together in January to start looking at some data, to start sense making around it, and to help us identify what actions we will take next, which will include talking with community to better understand reproductive and sexual health.
Awesome job, Rachel. Thank you.
You're welcome. Thank you.
So I'm only showing you this to say I already sent this to you in an email, and all of the resources that were shared today will be up on the PE46 website sometime next week, hopefully. Before we jump into the dialogue portion and unmute the phone lines, let's just do another quick poll. How confident do you feel about your plans for data, evaluation, and measuring progress? A, totally confident, have a plan and resources to do this. B, we'll make it work, we're short on something, resources or data, but we'll figure it out. C, I'm a little shaky, we're short on something, and I'm not sure we'll figure it out. Or D, this data stuff is still concerning, not sure we have the planning and resources to get very far.
Pretty cool.
It is okay to be anywhere on this spectrum. So it's feeling like folks are going to make it work, and they're going to figure it out. Some of you are still feeling shaky, and someone is still feeling pretty concerned about data. So let's dialogue. Okay, I'm going to unmute you all. Unmute. Okay, all participants are unmuted. If you would like to ask a question of any of our panelists, if you want to ask each other questions, some of you have emailed me in the last week or two, and I said, please bring your questions to Friday's webinar. Now is that time. We would like to hear from you. What questions do you have? How can we support you?
Mute, but I can do unmute all.
Okay, do that, yeah. Anybody want to say anything? You can also type your question if you want.
I have a question for Rachel. I was wondering if you could tell us how you're accessing the vital stats data. Are you using like the annual reports from the state, or are you getting the data from OFAT, or how are you accessing it?
So I'll give a short answer. We, as part of our Center for Public Health Advancement, we have a epidemiologist who we work with, Anna Menon, and she's getting the data, I believe, directly from OFAT, but it's not from the report that you all shared with us, if that's what you're asking. And so she would be somebody who I would have you or anyone else connect with to learn more about how she's gotten the actual data. Does that answer your question partly?
Yes, absolutely. Yeah, no, yeah, I know that OFAT is one of the resources that we're promoting, and there's a ton of data available through that resource. So
a ton, you're right. There's so much.
Yeah.
We are having trouble narrowing it down, what to share with community partners first.
So may I ask Rachel a question?
Yes.
So I'm really interested in how the county has divided itself up into the health equity zones. And I'm just curious about how you looked at different demographics in determining how zones are selected.
Well, so the health equity zones are something that far precedes me. It's not something we've done for reproductive health assessment. So, and again, it's a tool and a framework that's used for all of the work in public health. But short answer is it's kind of a proxy for school districts.
Okay. Oh, interesting.
And as you may know, many people know, Clackamas County is an enormous county in geography and also very urban and rural mix. So, and geography is just one way that has made sense to better understand communities that are very diverse. I'm wondering if Julie Albers is.
Hi, yeah, I was muted. Yeah, they're divided around the school districts, but we did an ethics review on the use of equity zones with our Public Health Advisory Committee before we implemented them, and wanted to not be quite so obvious about being school zones. The school people that were involved in that ethics deliberation felt like that implied that the schools were responsible for the health of those zones. So, whereas they are around those districts, that's not the primary driver, I guess I would say. But getting data by those equity zones is challenging, and our epidemiologist can translate zip code or census tract data into equity zone data if the data comes that way.
Mm-hmm. Okay. Thanks.
Any last minute questions? Well, I want to personally thank my panel of experts, or people that know more than me. Whether or not you think you're an expert, you know more than me. I want to thank all of you out there. I want to thank Clackamas County for sharing the work that they're doing. Ronnie and Tim, Stephanie, thank you. Rachel. If you have any other questions around data, this conversation is not over. We will continue to bring you resources in the new year. Also, feel free to email me if your questions were not addressed during today's webinar and you still need help. We are here. If you'd like to schedule a technical assistance phone call with me, just email me. So, thank you, everyone. Have a happy and safe holiday.
Thank you.